Good morning, everyone. My name is Sten Gustafsson, healthcare analyst here at ABG. Today we'll talk about OssDsign. We have the CEO Morten Henneveld here with us this morning.
Thank you.
A warm welcome and welcome back, I should say.
Thank you very much.
So you reported Q2 numbers last week, and I think we'll, unless there's anything you want to highlight specifically from the report, but I think we can discuss about the market, etc., instead of digging into the numbers again. So my first question is, or topic for discussion is the state of the US spine market. What's going on there? What's happening? What do you see in terms of patient volumes, etc.? That would be interesting to see what.
Yeah, no, absolutely. I think the spine market in the US is extremely healthy. Actually, it's the orthobiologics part of the market is estimated to be worth $1.8 billion a year. Within the general orthopedic segment, it's the fastest growing segment. And we know that our patients are typically 60 plus patients. So we have a baby boom from the Second World War that are now being treated, but also we know we have issues with obesity and other things that ultimately also increases the need for spinal surgeries in the future. So I think to your question around volume, we see an increasing volume many years out. Yeah. On a global level, I think the prediction is that the plus 60 group will double over the next 20 years. So I think there will be an increasing need actually in the future for spinal surgery.
And in terms of when it comes to spinal fusions procedures, there's I guess the gold standard is still to use autograft bone in those procedures, but more and more switch over to synthetic bone graft substitute. Is that?
Yeah, I think we're seeing some interesting dynamics. I mean, what you're describing as the gold standard, it's certainly the gold standard still as defined by the FDA.
Yeah.
Now, is that really the market practice? I don't believe it is anymore.
No.
Because, the gold standard stipulates that you harvest from the iliac crest, which is from the hip. It's another surgery. It increases pain for the patient. It increases hospitalization and therefore the cost of treating the patient. Yeah. So, whilst it may be technically the gold standard, it's not what we see right now. But surgeons have different options, right? They can use the what's called autograft. They can use allograft, which is the donor-based product. The US, there's still about a third of the market or so in the US that is doing it, but we are seeing a swing towards more, I would say, safer options, simply because with donor-based product, you have a risk of disease transmission, and there's been numerous cases, and they keep coming, as you know. So we are seeing, and when I speak to surgeons, they're getting a lot more hesitant to using some of these products. But I think it's also driven by the fact that when the synthetic products generally came to market, they did not show the same efficacy levels as autograft, right? So they were not on par. If you look at the latest generation, we are probably the latest generation product in the market, the fourth generation, but also if you look at the third generation, we all show performance which is as a minimum on par. Yeah. And we come with a more safe, with a better safety profile. So I think that's the second development. The third one we see is, as you know, within the synthetic part of the market, there are so many products on the market, and many are 15, 20 years old, first, second generation that are still out there. And it's very clear when you look at the clinical data that the latest generation are performing better. So we're also seeing a swing from the old one. So I think all of these developments are also providing tailwind for us today and will for many years out.
Yeah, no, I'm changing clinical practice takes time. Yeah. But would you say that the synthetic part the non-allograft, was that 1/3 or of the market? Or?
Yeah, I mean, when you look at some of the reports, you know, in medtech you don't have as great data as you do in pharma or other places. But yeah, it's about 1/3, but it is set to grow and is growing from what we can see significantly faster, which means that the market is swinging towards synthetic
it means that there will be good growth opportunities for the coming 10, 15 years at least.
It's a very good spot to be in.
Yeah, and the competitive landscape, any major changes? I know there are, you know, more than 400 approved products, which sounds crazy, but obviously with the 10, 15-year-old products also included in there. But are there new advanced products coming out that you see, or?
I don't think we see that much. Of course, we see new formulations coming to the market. But I wouldn't say it's anything material. I think that the dominating, what has accelerated again in the last couple of years, is the consolidation that's going on. It's happened, I would say, it's been characterizing the spine markets for many years, but it has accelerated again in the last few years with some of the big spine companies merging, acquiring. Many of the big ones are just not innovating when it comes to spine, in particular not when it comes to biologics. So
you mean they focus on the methods?
They focus on
robotics
on the hardware, and you know, in recent years it's been more about the robotics and the navigated, the assisted navigation technologies and other kind of latest technology that and less around the implants. But it also means, and this is known to everyone in the market, that just where we are in orthobiologics, that doesn't tend to be something that they really focus on in any way, which means that the bigger companies are acquiring innovation when it comes to this.
And then they can bundle the implants.
Then they bundle and use it to fill in, right? So I think that's more what we have seen, and we can see every time a company gets to a certain size and has a certain success, it tends to be acquired. So that's been kind of the norm for the last many years.
Perfect. Regarding OssDsign in the US, I mean, you're purely focusing on the US now, and maybe we have time to get back to that later. But I think you said in the report that you have approximately 10% access today.
I think we had less than 10% access still, right? Which means that we have more than 90% that we're not even touching.
So that's in terms of, or an approximation of the number of hospitals, or is that?
That's an approximation of the value that the market represent, right? So we're saying we have, you know, we're getting closer to the 10% mark in terms of value access. Yeah,
but I mean, you're still a very young company in this space. I mean, it obviously takes time to build up, and especially if you have somewhat limited resources at hand. But do you have a feeling for how many surgeons you have trained over these years?
No, we know exactly how many surgeons. You know, it's not something that we want to share. No, but I mean, coming back to your point, right? Because we have had an exceptional start. We just hit the $100 million SEK mark on a rolling 12-month basis, right? Yeah. And yes, we have come. You know, we've started OssDsign as an orthobiologics company, and I think people often tend to forget that because OssDsign is an older company, really. But as an orthobiologics company, we're only about 2.5 years old, right? And I think it's worth noting that we got to the 100 million SEK mark within approximately 2.5 years, right? When you look at our competitors, when you look at other companies that people tend to compare to, this is much, much faster than what some of the other ones. I mean, one of our big competitors, it took them 10 years to get to this level. And we got then 2.5. So I think we should be very, very proud. And I think it shows that the product we're bringing to market, even in a very competitive environment, it does resonate with surgeons. It has a good story. It's now coming out showing strong clinical data, still early days, but what we are publishing is exceptionally strong data. So we should be very, very proud. And the way I look at it is that we have given ourselves a very unique opportunity actually to run faster than competition, because but at the end of the day, it's also an equation, of course, of how much you invest in the company, right?
Yeah. But of the surgeons you have trained, do you get a feeling for the utilization among sort of the trained surgeons? How often do they use it for every spine fusion, or a certain type of fusion?
I think it depends. I mean, many surgeons do what surgeons often do and should be doing, which is when in particular when the product is novel and hasn't really been used broadly in the market. So this is more I would say in the early days. They take it nice and slow. Maybe they treat a handful of patients. They wait some time, see that everything works as we promised it would. Patients are doing well, and then they take it from there. Yeah. So they start small and gradually expand. Then I think there are a million different variations of how we've been used. Some may only use us for cervical, for the neck. Yeah. Some may only use us for interbody, in particular now that we have the clearance. Some use us for other things. So some only use us for certain procedures. Some use us for everything. So I think you're seeing it. You're seeing it all, and it varies very much. Surgeons have different preferences for different things. Some only wants to use what's called a strip, so a different formulation instead of ours is a putty product. And of course, for those surgeons, we don't have that in portfolio today, so we can't serve that need. Yeah. But it's clearly our ambition to do that in the future. Yeah.
Well, I mean, there are many orthopedic surgeons at every hospital, so I mean, maybe you can't win them all, but I mean, slowly and gradually, it sort of plays out.
No, absolutely, and I think 2024 is also a different year for us, right? It's the first full year as an orthobiologics company. It also means there are many things that ideally we would have wanted to do early on, but we just couldn't do it when we had the cranial business. Cranial took up a lot of time in the organization. And also, as you know, the market, we need to be responsible for how we are spending money, and the investments ideally you should have made in the orthobiologics business already in 21, 22. Yeah. We just couldn't do it because of where the market went in those years. So 2024 is also very much for us about really setting a new baseline in the new OssDsign and then move forward from there.
What do you? I mean, I guess surgeons are probably maybe easiest is the wrong word, but they what I'm trying to get at, what's the main bottleneck, and convincing a surgeon with a little bit of clinical data and take a look at the product, they get excited, something new, and then it takes forever until it's processed sometimes. Yeah. What's your?
Well, I mean, that's the market dynamics right now. We have to go through these VAC approvals, as we got many questions about on the Premier contract. Even under the contract, you still have to get approved hospital by hospital. And that takes a lot longer than what we're used to. So is that a bottleneck? I don't know. What it means for us is that we've had to think a little bit differently, which means that we simply have we've been forced to process many more submissions simultaneously, which means that our sales funnel or our pipeline, we've simply had to grow it a lot more. Yeah. And sometimes it does become a bottleneck. We had a region earlier this year and towards the end of last year where we simply had so many approvals coming through in one go that we just couldn't keep up with it, which is an annoying position to be in, given that you've worked really hard to get it right. So, I mean, as you said, I think some of the bottlenecks for growth, we have driven all sales acceleration that has happened in the company within the last 2 years is driven by increased sales force efficiency. So we're simply selling. So we're selling 10 times more per salesperson today than we were back in the cranial days, at least when I came to the company. But we haven't added any salespeople really.
And have you added any of these IDNs? I mean, is that because you have your regional managers, and I think it's 7 or 8 sales reps in total in the US, but I assume that a part of the sales is going through the IDNs, or...
Well, I think IDNs as such are no different than a group of hospitals, right? You know, you can almost argue that most hospitals today will be some level of IDNs because they are all affiliated.
Okay.
You know, in the US, most healthcare is for profit, which means that it's run by private organizations, right? So I don't think you can compare. That's just where the market is, right? You have smaller hospitals, you have smaller group of hospitals, you have large group of hospitals, you know, like some of the IDNs that we've been winning that are these enormous ones. Then you have some even bigger ones that have more than 50 hospitals that we haven't got into yet. So I don't see that really changing anything. That's just how the market is characterized, right? And we are navigating that. We were of course blessed with having strong relationships, which you know is extremely important when it comes to medical device sales. So we're using that to the best of our ability.
Okay. So the training of surgeons is done by the 7, 8 sales reps you have.
Yeah, and our distributors, right?
Yeah.
But I think I think it's important to stress that if a surgeon starts to use our product, there is no change to the procedure. There is no training required, right? Today they may use a white box, and now we have a white and pink box, and they change that. Of course, what we're hearing is that we have exceptional handling, but this only makes life easier for the surgeon. So we don't need to be in the OR. Of course, we need to demonstrate the product. But in terms of the actual OR, there is no change to the procedure for surgeons, right? So we don't need to train what you call train them. That's not, we don't need to, but we do need to explain about the product.
Excellent. Let's talk about your expansion plans. And you talk about new products, new market segments, for example. Do you plan to go outside of the US?
Well, I think we're seeing a lot of opportunities in the US. And I think if we have to spend $1 right now, an incremental $1, I think we would rather spend it in the US as opposed to outside of the US. That doesn't mean there's not a need or potential opportunities.
No.
But as I said earlier, we've not added any salespeople in 2 years, right? So everything that we've achieved now is driven with the team that we already had. And as we talked about in the beginning, there's 90% of the market, right? We've had an exceptional good start. We have a much faster trajectory.
So you could out-license the product to someone for Europe, for example?
That potentially, yes, that could be something that could be discussed if that came up.
Other region, Japan?
But you know, it's never as easy in practice as it is on paper, right? But no, we're seeing some. We have line of sight, I would say, to some very real opportunities, right? We can increase our market coverage. Today, overall, after the cranial business where we let go of 50% of the people, we are only 30 left total in the company, right? I think people need to be mindful of that. We are now a fairly small company in terms of people at least. And whilst we've had a fantastic start and we are ahead of our own plans when it comes to access in the US market, there's still 90% that we're not touching. So of course, you know, more horsepower, more better coverage, not least not just in the sales team, but also from a marketing perspective, now that we now have an incumbent user base that we need to leverage. I think that is a very, very clear growth opportunity. We can now see that 4 years ago when I came, I wasn't very happy with the sales force efficiency, so the sales per person. Now we are actually approaching a level which is comparable to many of our competitors, which means that it makes sense to actually add new salespeople because we can see they are driving incremental growth. So I think that's the first growth opportunity we have. The second is new product development. We still only have the what's called the party product that we deliver in a syringe. Now we have so many contracts, we have many incumbent users. There are other products that you need to have in your portfolio, and these will drive incremental revenue, MIS products, strip products, and other things. And I think the NPD specifically, so new product development, is a good example of things that we already knew we should be doing several years ago. We just couldn't do it when we had the cranial for resource due to resource constraints. So that is a very clear area now that we are an orthobiologics focused company that we have to mobilize forward, right? You know, it takes some time to develop products, unfortunately. So we need to get going. The third one is clinical. We have come out with clinical again, like sales, at a much earlier time point actually than when we look at the trajectory some of our competitors and peers had at the time. So we are ahead of the game. We may be a few years behind them still, but when you look at where they were after a certain number of years, we are much further than that. So we've created a good opportunity also on the clinical side, but of course we need to invest it in, and we are seeing the market moving increasingly, I would say, to also demanding more clinical data on the product, which is a good thing as far as we're concerned. And then last but not least, you know, we are cleared. We have a clearance that goes way beyond spine. We are cleared for extremities. We are cleared as a bone void filler for skeletal defects, which means that we basically go into trauma tomorrow if we want it. But what we've said is that we are now slowly starting to enter the foot and ankle market. It's a $60 to $100 million market. So still fairly small, but we're getting really good response on the product also for the foot and ankle cases. So we're doing it very slowly. We don't want to distract from the strategic focus on spine. So right now it's ring fenced only with very few people to build it up.
And when can we expect to hear more about your plans for clinical trials, etc.? Is that next year or maybe already this year?
I think as soon as we make decisions on some of these things, right? I think we have a very good line of sight to what we want, but you know, there is also discussion about what is the level of investment that the company can do, right? And unfortunately, the way growth works is that it is somewhat proportional, assuming you make the right investments. It is proportional to the level of investment you have in the company, right? So that's of course something that we constantly discuss in the company with our board, with investors, to try to find a level about, you know, where should we be placed on that scale.
Sounds good. I think we're actually running out of time. Thank you very much for stopping by here at ABG, and best of luck in the future.
Well, thank you very much for having me again.
All right. Thank you.